brand new banger. You're jamming with the hottest disc jockey. Exclusive hot new mix. This DJ is breaking all the knobs off. Let's go.
Wait a minute.
Hot shit. Here it comes.
Hello, Philippines! Hello, Dumagata! This is your host, Roblyn Sunga!
Think I'm in love.
Here in the Philippines, lung ailments are still on the rise. In actuality, one of the most prevalent causes of lung disease is chronic obstructive pulmonary disease. It is a major cause of death in our nation, and those who have it are more likely to develop a number of other diseases. The quality of life for these people might be considerably enhanced by proper awareness and early detection. Today's session will cover the disease symptoms, diagnosis, prevention, and of course, therapy.
Kasama ang nag-iisang papa ng virtual world.
Welcome to MedTalk. This is your host, Roblyn Sunga. The fact that patients frequently fail to receive early-stage preventive care is a major factor in why chronic obstructive pulmonary disease, or COPD, is so widespread in the Philippines. Now that they are here, our visitors can advise us on the warning indicators to look out for and the best course of action. We are joined by Dr. Anaphy a pulmonologist from Makati Medical Center and a public health specialist certified by the Philippine Society of Public Health, and Dr. Jade Maicam Pabinggit, an interventional pulmonologist from the Makati Medical Center and an expert in infectious disease from the Asian Hospital and Medical Center. We indicated earlier in the program that despite being so prevalent, COPD is a major cause of death both in our country and around the world. Both prevention and treatment are possible. The highest incidence rate of tuberculosis, or the so-called TB, in all Asia is currently being experienced by approximately 1 million Filipinos. Now, Dr. Jessa, let's discuss COPD.
Thank you, Roland Sunga. So it is a very common, treatable, and preventable disease which is very rampant in our population. It is sort of something which is really preventable if you are going to look at risk factors for the development of COPD. COPD traditionally was defined as being a spectrum of two entities, namely the chronic bronchitis and emphysema. So they are the end of both spectrum, but majority of our patients who have COPD is a mixture of both, and they're somewhere in the middle.
Dr. Jessa, how long does it often take for some of these symptoms in a COPD patient to worsen?
You cannot answer that question without discussing one of the major risk factors for developing COPD, which is the cigarette smoking. Now, it has been studied that as the number of cigarettes that you smoke increases in the number of years that you have been smoking also increases, it likely increases the possibility of someone having a COPD. Now, it has been studied that people who smoke will need to have 15 pack years of smoking before they develop symptoms of COPD.
So, Doc, how might someone with emphysema and chronic bronchitis looks like?
First off, a patient with COPD who has chronic bronchitis will experience swelling and inflammation of the inner lining of their airways. Now, the lining of the airways is inflamed. There is an increase in the formation of sputum or mucus discharges. This increased mucus production combined with the inflammation causes the airways to become smaller and limiting the airflow. They are known as blue bloaters because they frequently have low oxygen levels. In contrast, pink puff First are patients with emphysema who really exhibit symptoms of breathing troubles.
Jessa, let's talk specifically about chronic bronchitis. I want to know about the distribution of males versus females because we'll discuss the reasons why someone would be at risk for it later in the program. According to some estimates, women are more likely than males to develop chronic bronchitis. What causes this?
This may be related to several issues, such as the fact that smoking rates among women and men are now equal, because women's lungs and bronchial tubes are smaller than men's. Researchers now believe that smoking may be more harmful to women's lungs. Thus, even a small amount of smoke ingested may result in greater harm. Given that women's lungs and bronchial tubes are smaller than men's, several research suggested that breathing pollutants may also cause more harm to women than to men because of their smaller lungs and bronchial tubes.
If someone has chronic bronchitis and does not receive treatment or alter their lifestyle, what would you say, Dr. Jade? They will eventually reach the stage where they get emphysema?
Hello, Rovalyn. No, there are actually 4 stages of COPD or chronic pulmonary diseases. So, this phases, the stage 1 is the moderate. The second stage is the severe one. And the third one is the very severe. And lastly, the fourth stages is the mild respectively. So, in stage 1, you might not have any symptoms at all. But in stage 2, you might need to take a break every few minutes to catch your breath. And the third one is that you might be out of breath and leave the house. So you might need to be out of breath to dress and undress. So lastly, you could experience heart or lung failure in your COPD or chronic pulmonary diseases. So it is in the most severe stages. So which is the stage number 4.
Thank you, Doc Jade. Similar to chronic bronchitis, this condition is characterized by a persistent cough, wheezing, and fatigue. Your doctor will likely to order tests to determine how well your lungs are functioning and whether you have emphysema. You won't be able to expel the air from your lungs as quickly or efficiently as you ought to. When we return, we'll discuss the risk factors that contribute to emphysema, chronic bronchitis, and COPD, generally to determine what is causing this airflow restriction. We are now your healthcare partner on this MedTalk.
Mommies, babies are very sensitive to the heat of the sun. Kaya naman, iwasan natin silang ilabas between 10 a.m. to 4 p.m. kung saan matindi ang sikat ng araw. This is important to prevent dehydration for our babies.
Tara na! Handa ka na ba? Handa ka na bang makipagsabayan sa kulitan?
Welcome back to MedTalk. My name is Rovalyn Suna. Our duty is to care. If you have these symptoms, such as wheezing and exhaustion, possess the risk factors we'll be talking about later. Asthma, which is a very common condition in the Philippines, is a type of lung disease that also causes some form of swelling in your airways and some form of difficulty breathing. You may have chronic obstructive pulmonary disease or COPD, which is a group of lung diseases that make it difficult for people to breathe. Let's briefly discuss asthma. Dr. Jessa, what occurs to a person's lungs when they have asthma and how is it different from COPD?
So asthma typically affects younger age groups, whereas COPD patients typically have symptoms after turning 40. Another distinction is that COPD symptoms frequently worsen over time since they are progressive. Asthma is quite varied. Therefore, if a patient, especially one with milder types of the disease, does not experience any attacks or exacerbations, they are appear to be very healthy with no signs such as wheezing or shortness of breath.
Now, let's discuss about the primary causes of COPD in the Philippines. Now, we've touched on some of the risk factors earlier in the program. Dr. Jade, please take the lead on that. We already know that smoking cigarettes plays an important role in the development of COPD, but there are other risk factors as well, including exposure to secondhand smoke, the type of employment a person does, and specific ingredients used in the cooking. And you discuss some of the COPD risk factors.
So there are actually different types of developing chronic pulmonary disease, or which we call COPD. So despite the fact that smoking is one of the top risk factors for developing COPD, and it is because it harms or destroys our airways, or the tiny air sacs known as alveoli. So smoking can still cause lung disorders. So as you can see, previously said that smoking can lead to lung disorder like COPD, emphysema, and chronic bronchitis. And it's also important to know that we should understand that smoking can also cause other types of cancer, so including the lungs cancer. So in smoking tobacco, it also might start an asthma attack or aggravate an existing attack if you have an asthma already. So we should all know that smokers have a 12 to 13-fold higher risk of dying from chronic pulmonary disease, or the COPD, than the non-smoker do. So although there is a secondhand smoking, non-smokers are also exposed. So not just to the smokers but also to the secondhand smoking can lead to COPD diseases.
How does air pollution contribute to COPD?
So we all know naturally that the purpose of our lungs is to take in oxygen and expel any gases to our bodies. But however, exposure to too much air and other environmental factors as well as the other causes, it can also be exceedingly harmful to our lungs and anyone who breathes in this kind of gases. So as we have discussed previously, occupational asthma can also cause breathing, coughing, lung irritation, and other symptoms. And there has also been a report on these workplace hazards, which we can find in certain news in addition to the chronic pulmonary disease and occupational asthma. So, as given to the each patient and person who is justified, as well as the evident contextual conditions. So, we should think about protecting our environment as well, because doing so, it also entails protecting ourselves, because we are all exposed and vulnerable because we share in the same environment, or which we call our Mother Earth. So according to the research, as we have researched, although a few studies have shown that vaping is significantly less dangerous than cigarette smoking, but it doesn't mean that it is less. So according to our research, or what we have researched, although a few studies have shown that vaping is significantly less dangerous than cigarette smoking, but it is still the same risk factors that carries the development of chronic pulmonary diseases. So it doesn't necessarily means that it is less dangerous than cigarette smoking.
COPD is preventable and it is treatable. When we return, we'll talk about ways in which those diagnosed with COPD are managed and treated, and what you can do to help prevent it from happening. Your health is our mission here on MedTalk. We'll be right back.
Mag-Centrum Advance. May over 25 protective nutrients. Tulong para protektodo ang heart, immunity, energy, at buong katawan. Centrum Advance.
Welcome back to MedTalk. My name is Rovelyn Sunga. Many people find living with chronic obstructive pulmonary disease, or COPD, to be burdensome. However, there are many methods that people can reduce their symptoms and prevent the condition from getting worse. But what we want to emphasize here is the importance of prevention. Let's discuss some of the therapy choices for someone who receives a COPD diagnosis here in the Philippines. Doc Jessa?
So it will depend on how severe their COPD is. Now, as far as medicines are concerned, the mildest form of COPD we can do away with giving just short-acting bronchodilators as needed. Now, as you go up higher in severity scale, we have this what we call the long-acting muscarinic antagonists in the form of inhalers, and if that doesn't work, we go to long-acting beta-2 antagonists. And for those more severe patients who seem to not respond to previous medicines, we go for combinations of all of these things.
So, Dr. Jessa, we've been talking about ways on how to prevent this ideally. Let's talk about the biggest risk factor here, which is the cigarette smoke. Now, ideally, you wouldn't want to try and find something safer because cessation of smoking is the best option here. Now, my question is, for someone who is diagnosed with COPD and they take away the biggest risk factor there, could be cigarette or their occupation, will the lungs go back to its normal situation?
In the case of COPD, no, it won't return to normal. But by using the stages that Dr. Jade mentioned before, we can stop a patient's COPD from getting worse. If you started smoking as of right now, start quitting immediately. Our rural health units offer cessation clinics. And for those who have not begun smoking yet, do not ever start smoking in order to prevent exposure to COPD and other lung ailments. There are trained professionals are starting in rural health centers and at our DOH retained hospitals to assist you in quitting smoking. Although our lungs won't return to their normal state, we can lessen the severity of COPD.
Naturally, Raba, quitting smoking is one of the healthiest things you can do for your lungs. If you don't smoke already, you can stop it in order for you to protect yourself from being exposed to harmful gases and particles. During the pandemic or because of the pandemic, we are now accustomed to wearing masks to protect ourselves. It has been proven through the research that using a mask lessens the risk of chronic pulmonary disease. The COPD patients being exposed to triggers that could aggravate their condition. So naturally, a nutritious diet will also benefit the rest of your body, including our lungs or your lungs.
Even though the COVID-19 pandemic is still in the news, there are other infectious diseases that we should be aware of. Tuberculosis being one of them. According to the World Health Organization or the WHO, it is the infectious disease that, after the coronavirus, has contributed to the most fatalities. Why is TB so prevalent in the Philippines, especially Dr. J?
Actually, there are many social factors of TB or that which we call tuberculosis infection. And regrettably, we have not yet advanced to the point where we can effectively control it. But in inability of patients to receive treatment so they can avoid spreading an infection to other that might impacted by certain socio-economic variables like poverty, crowding, and health-seeking behavior. So therefore, these are the things that affect or how and why the number of tuberculosis cases in the nation is large.
Now, a significant factor in the prevalence of TB in our country is the fact that many people ignore the ailment until late symptoms or the lack of preventive measure. We frequently cite prevention as the best form of treatment. In the meantime, the majority of people have TB may not show any outward symptoms when they are first infected. We'll talk more about prevention strategies later in this program. Dr. Jessa, could you please explain the distinction between latent and acute TB?
When you refer to latent TB, you are referring to someone who has either a bacterial infection or TB bacteria, but who is asymptomatic. So they have a type of TB that is not active, and they typically cannot spread infection compared to TB patients who have the disease. Instead, they have presumptive TB, which is typically believed to have been clinically diagnosed by the attending physicians and verified by bacteriology. There are others who exhibit what are known as the cardinal signs and symptoms, which include the cough, unexplained weight loss, an extremely high fever, and night sweats. And these individuals may have pulmonary tuberculosis or extrapulmonary TB, depending on how long their symptoms have been present. And when we refer to extrapulmonary tuberculosis, we mean to type that affects organs other than lungs.
What are some of the elements that could cause the latent TB to turn active?
So these patients typically belong to the so-called TB high-risk groups. These patients include those who have HIV, those who are in close touch with TB patients, geriatric patients, or even our patients with uncontrolled diabetes. Since they are immune-compromised type, they may become active from their latent TB. Consequently, they will develop into a TB disease.
Let's now discuss the treatment for tuberculosis. Many of our viewers, Dr. Jessa, who have TB, say that after receiving antibiotics for 7 to 10 days, they are already fine. Is this situation comparable to TB?
Actually, Rob, no. There are numerous ways to treat TB if you have been diagnosed with it. According to the organs involved and the drug susceptibility, the average length is 6 months or longer. However, some patients have the multi-drug resistant kind of TB, which can be treated with a variety of medications. And if the patient has pulmonary TB and is responsive to treatment, we typically provide regimen 1 treatment that lasts for 6 months, and this includes isoniazid, rifampin, pyrazinamide, and ethambutol. But it's crucial that you speak with your doctor about it because it's crucial to keep track of the medication that TB patients are taking.
What are some of the actions that everyone of us can do to help eradicate TB, Dr. Jessa?
So we have learned from the COVID-19 pandemic that people are more aware of infection control. So it's crucial to use a mask when someone is ill and coughing. We advise them to be able to contain their cough and cover the cough to reduce the risk of aerosolizing their secretions. This is also crucial if we contract tuberculosis ourselves.
Please go over some of the typical pneumonia symptoms, Dr. Jessa.
So the most typical symptom is coughing, though there may be others. It may be dry or prolific and have mucus that is green, yellow, or even blood colored, depending on the organism that caused them. Symptoms like colds, shortness of breath, nausea, diarrhea, headaches, runny noses, and appetite loss may also occur.
Is there a method to differentiate pneumonia from a simple case of the flu or a typical cold?
So cold symptoms typically don't include fever but instead include a cough, sore throat, stuffy nose, sneezing, and watery eyes. Cold symptoms can take some time to develop. The flu symptoms follow and they frequently include excessive exhaustion, body aches and muscle aches, loss of appetite, headaches, high fever, chills and sweat, and as well as stuffy nose and coughing.
Dr. Jessa, if you detect pneumonia in a patient, are there any tests you might run to confirm the infection?
Actually, we build it in a solid clinical history and concentrate on a chest or lung physical examination. And we inquire about the patient's most recent symptoms, exposure to the environment, and past health issues, particularly any history of smoking and comorbidities, conditions including diabetes, hypertension, asthma, and kidney disease. Then we ask for the diagnostic procedures like chest x-ray. We can identify a potential bacterial or viral cause of pneumonia by looking for specific x-ray patterns.
So one of the issues that immediately comes to my mind when thinking about pneumonia in children is the immune system's maturity. So the children's immune system have not yet been exposed to the most prevalent bacteria or viruses that adults have. So therefore, we do not yet have an immunity to those kinds germs.
Nowadays is receiving the pneumonia vaccine, a good preventative strategy recommended for the elderly. What about the young?
So every year, you should get vaccinated against seasonal flu. Since pneumonia frequently results from the flu, avoiding the virus is an effective strategy to avoid pneumonia.
Dr. Jessa, let's discuss the treatment regimen now. How is pneumonia treated in adults, particularly in those who have comorbidity conditions, and how can it be avoided?
So the majority of the time, pneumonia can be treated at home with rest, antibiotics, and if a bacterial infection is likely to be the cause, and plenty of fluids. But in severe situations, hospitalization may be necessary.
Dr. Jessa, how to prevent pneumonia?
So you should keep in mind to practice these 5 habits every day. First, stop smoking. Exercise frequently. Reduce your exposure to pollutants. Drink plenty of water instead of soft drinks. To prevent infections, take your multivitamins and breathe deeply like you're doing breathing exercises. By concentrating some of your energy on these 5 habits, you can help your lungs function at their best for the rest of your life.
And with that, we would want to express our gratitude to Dr. Josephine Maquinano and Jed Micah Pabingit for joining us today and sharing their knowledge and expertise on these lung disorders. We value your time and knowledge. Hi there, I'm Roblyn Suma and I appreciate your listening to Med Talk.